Hey, Chris. Yeah, the 5 confirmed cases of this new coronavirus variant brings the total amount to at least 68 nationwide. And health officials here in Minnesota say while they aren't surprised to see this variant arrive in our state, they are hopeful that we can contain the spread of it.
For weeks now, we've been hearing about a new variant of the COVID-19 virus first discovered in the UK back in September, according to the CDC, which has now reached 9 states, including Minnesota. According to the Minnesota Department of Health, 5 cases of the variant have been confirmed in the Twin Cities metro area, those cases in people ranging in age from 15 to 37. 2 of the cases, health officials say, were linked to international travel, while 1 case didn't involve travel, and health officials say a travel history for the remaining 2 cases is unknown. In a statement from MDH Infectious Disease Director Chris Ersman, she says considering this variant strain is thought to be more contagious, this reinforces the importance of wearing masks, social distancing, and quarantining if exposed to a positive case. But the good news, health officials say, is preliminary studies show the current vaccines being administered are effective against this new variant strain, which is why the state epidemiologist Ruth Linfield says getting as many people vaccinated as possible will help control the spread of this new strain while preventing the emergence of others.
Now, the state epidemiologist says this new variant hasn't been known to cause more severe illnesses, and the 5 confirmed cases here in the metro area never involved any hospitalizations. Chris?
Okay, thank you, Devon. Appreciate it.